In this video we'll discuss facial nerve monitoring. Before we begin, consider the following questions. When should a facial nerve monitor be used? How is a facial nerve monitor set up? What is the role of the various components? Why does tapping on the facial muscles elicit a response during monitoring? And at what level of stimulation does the nerve usually respond? Facial nerve monitoring plays an essential role in the identification and protection of the facial nerve during surgery in proximity of the nerve and its branches. Such operations include tympanomastoid surgery and head and neck surgeries, particularly those involving the parotid gland. Nerve monitoring is especially important in procedures that involve powered instruments such as rotating burrs. These include mastoidectomy and canalplasty, whereas it is not necessary in simple tympanoplasties or ossiculoplasty. Similarly, it is not suitable for cases under local anesthesia due to the needles being placed. For cases under general anesthesia requiring facial monitoring, muscle relaxant should be avoided. To monitor the nerve, a paired electrode is placed within a muscle that is innervated by the facial nerve. This electrode detects the baseline level of electrical stimulation within the muscle and compares it to a reference electrode which is placed in a muscle not innervated by the facial nerve. Each muscle being monitored forms a separate channel, and ordinarily between 2 to 4 channels are used, with the orbicularis oculi and orbicularis ori muscles typically used for tympanomastoid surgery in a 2-channel setup. In parotid surgery, 4 channels are often used. If a handheld nerve stimulator is to be used, a further needle can also be inserted in the area not innervated by the facial nerve, which serves as a return electrode. During surgery, if the nerve is irritated by the thermal or mechanical effects of surgical manipulation, this can induce an action potential within the nerve. This is transmitted to the motor end plates, resulting in depolarization of the muscle, and this change in action potential as compared to the reference electrode is registered as stimulation. Often, once the monitoring circuit is set up, surgeons may tap on the muscles to confirm functioning of the monitor. While the utility of this test is debated, the premise is that tapping on the face causes a local depolarization of the muscle, which is detected by the monitor. In cases where close dissection to the nerve is required, a handheld monitor stimulator is often used. This presents a current at a given level to the tissue to which it is applied. If the tissue is not the nerve, this will not induce contraction of the facial muscles, whereas when applied to the nerve or close to its proximity, this will transmit an action potential. The current needed corresponds to how much tissue there is between the nerve and the stimulator probe. Where the nerve is within its bony canal, a current of around 2 milliamperes should induce an action potential. If the nerve is exposed, but with a thicker perineurium, approximately 1/10 of this should stimulate the nerve, and currents of 0.05 to 0.1 milliampere will stimulate the nerve when applied directly to exposed nerve fibers. I hope you found this video to be useful. Please consider subscribing and let us know what you'd like us to cover next.